Hi, I'm Dr. Obermeyer, and the purpose of this video is to describe rotator cuff arthropathy. Rotator cuff arthropathy is a condition characterized by progressive wear and erosion of the ball and socket or glenohumeral joint of the shoulder as a result of a primary injury or tearing process affecting the tendons known as the rotator cuff. When the rotator cuff progressively tears, the tendons no longer are capable of holding the ball in the shallow dish of the shoulder joint. And as a result, there is an unopposed pull of the larger muscle on the outer portion of the arm known as the deltoid, which progressively leads to the ball escaping or eroding out of the upper portion of the socket. This phenomenon, rotator cuff arthropathy, was originally observed in the early 1980s, which led to a progressive and characteristic wear process of the glenohumeral joint where the ball and socket progressively become arthritic in very characteristic patterns. Rotator cuff arthropathy is a somewhat unique and distinct process in comparison with the also commonly encountered primary glenohumeral osteoarthritis, which is just an arthritic process affecting the bones or the ball and socket of the shoulder. The diagnosis of rotator cuff tear arthropathy is typically made with a combination of clinical findings, which include symptoms of pain, limitation of function and weakness, as well as characteristic physical findings notable for the deficiency and the absence of a functioning rotator cuff tendon when the arm is examined. There are also very common and characteristic imaging findings for rotator cuff tear arthropathy, where the tendon deficiency and tendon tearing process is noted on imaging, specifically MRI, and there are also very commonly X-ray and CT changes looking at the bones of the shoulder frequent in this disease process. Some patients are very appropriately treated with non-surgical treatment consisting of exercise-based interventions as well as injection treatments. The corrective and definitive treatment for rotator cuff arthropathy is a shoulder replacement. Shoulder replacement for rotator cuff arthropathy is a very successful and commonly performed procedure that has benefited hundreds of thousands of patients over the last several years since this surgery was originally described for this condition. The shoulder replacement utilized for rotator cuff arthropathy is somewhat unique and distinct from the conventional implant utilized for primary shoulder arthritis. Specifically, as a result of the rotator cuff deficiency, the shoulder replacement known as the reverse prosthesis flips the ball and socket or the concavities of the shoulder joint so that the ball is fixated on the socket, thereby capturing or stabilizing the shoulder joint and effectively recruiting the bigger, more powerful muscle known as the deltoid that can take over for shoulder function, range of motion, and activities. The sturdiness, durability, and longevity, as well as the clinical outcomes with reverse total shoulder replacement for rotator cuff arthropathy, have allowed this implant to become the most commonly utilized shoulder replacement in the United States. Please refer to our website for more information, and thank you for your interest in rotator cuff arthropathy.